Well, good afternoon and welcome back to the inaugural Women's Health Expo. If you're tuning in on the live stream, hello, thank you for joining us. I am absolutely delighted to introduce our next speaker. Liz Gosch is from the Pink Elephant Support Network, and she is going to be talking about navigating through miscarriage and early pregnancy loss. Liz,
thank you so
take
much.
It away.
Thank you. Hi everybody, a little bit lonelier up on the podium for this session. As Georgie said, my name's Liz Gosch and I'm a patron of the Pink Elephant Support Network, and I'm here today to share their story. Georgie mentioned towards the end of the last session that stigma is a theme that had been running through everything that you've been talking about today, and I'm afraid that continues with the area of miscarriage and early pregnancy loss, and really that's at the base of what Pink Elephants are here to do, and that's to smash those stigmas and to create a new narrative for early pregnancy loss. So I just want to let you all know that obviously some of the things that I'm talking about today can be quite difficult for people. There's absolutely no shame in being upset or affected by this information. There is sadness involved, but there's also, in the telling and in the listening, there's validation, and that's so important for people who've lost their baby. And it also is really important for the wider community to help them understand. So please reach out if you need support. I'll be around afterwards. I have lived experience of miscarriage. I lost 2 babies on my IVF journey to have my little boy as a solo mum. And I also work with Genea Fertility, Pink Elephant's national partner. Genea is incredibly proud to have supported this amazing organisation for close to 4 years. So back in 2015, Pink Elephants started with a coffee. Samantha Payne met with Gabby Armstrong for support because she was feeling really isolated after her second loss. And during that first meeting, Sam and Gabby talked about the lack of support that women were receiving when they experienced miscarriage. In 2015, despite the fact that 1 in 3 pregnancies ended in loss before 12 weeks, there was no support specific for women going through this anywhere in Australia. From the initial diagnosis to the ensuing loss, to the procedures and not knowing what to expect, right down to the support that partners, family, friends, and even healthcare professionals could give. Women deserved more. Information needed to be offered, conversations needed to take place, validation needed to be given, and connections needed to be made. Sam and Gabby wanted to create a community where women could come together and grieve. A safe place for information to be shared, a place to be supported and nurtured, and a central place with reliable information that was delivered in a sensitive and empathetic way. And so Pink Elephant Support Network was created. Why pink elephants? It wasn't the elephant in the room, although that probably would have been appropriate. It's the fact that within an elephant community, when a mother elephant loses a baby, the other elephants join their trunks and create a circle of support, a virtual circle of support around that elephant. And that's exactly what Sam and Gabby wanted to create. Now, as I said just now, in Australia, 1 in 3 women will lose their pregnancy before 12 weeks, and some of them without even realising that they were pregnant. That's 110,000 families every year experiencing miscarriage. 1 in 6 Australians will experience infertility, struggling to conceive their first baby perhaps, or having trouble growing their family. Pink Elephants began to research these statistics and found that pregnancy loss is incredibly common. It's strange, as younger women, we often don't really know how many people in our community have lost a baby until we go through it ourselves. In my experience, it wasn't until I lost my first baby that 2 of my closest friends shared that they'd also experienced miscarriage. The problem that Pink Elephants identified was that this commonality was actually forming a barrier to women getting the help and the support and the information that they needed. Instead, women were being told, it happens all the time. At least you know you can get pregnant. Go home, try again. And other heartbreaking comments. The truth is that no matter how common miscarriage is, these women had lost their baby, an entirely personal and individual experience. So much of the experience of miscarriage was based on old science, outdated perceptions, social anxiety, and often mistruths. Pink Elephants wanted to write the story of early pregnancy loss by smashing the stigmas and creating a new narrative, as I said, and hopefully creating a healthier experience for everybody. So they ran research to make sure that what they'd heard anecdotally was actually happening and being experienced by others. And the result was a resounding yes. The majority of women going through miscarriage felt unsupported by their immediate and wider support networks. Most felt invalidated in their grief, and there wasn't a central place for them to find reliable information about miscarriage and everything that was happening to them. Just the mere fact that they had to go to Google for information, and the only way that they could find information was isolating for them. So that survey, that initial survey that Pink Elephants conducted, spoke with 1,700 women. 75% of them felt unsupported through their miscarriage, and 60% wanted access to peer support. A second survey then conducted with the University of Melbourne showed similar results, with 88% wanting a referral for peer support. So in response, Pink Elephants poured their heart and soul into mapping out the support that women needed and figuring out what resources they could offer to help. They wrote content and they had it designed beautifully, and the brand aesthetic that you can see through these slides was intentional. It's designed to be a virtual hug when a woman needs it most. All of Pink Elephant's resources are peer-reviewed not only by other women who have experienced loss, but also by frontline medical professionals. They launched social media channels with an aim to raise awareness of the impact of early pregnancy loss, to dispel the myths, to challenge those cultural norms, and to break the silence. Gradually, these accounts grew into communities specific to all of the different ways and areas and experiences that can surround miscarriage, such as people who are then trying again, preconception, people within our sexuality and gender diverse community who need support, support for people who are pregnant again after loss, and support for people who have had to have termination for medical reasons. Word of their support services grew, and every day more women have been engaging with their content, downloading the resources and joining these online communities. They went on to create a personalised peer support program, which gives women access to mentors for free phone sessions. And this is really important and innovative because it means you can build a meaningful personal connection with an ambassador who understands your pain. And once again, the feedback was incredible, and this program continues to grow and develop. This amazing organisation then turned their attention to the workplace because respondents to those original surveys had also showed that it was an area that needed help. Women were saying things like, I wanted my colleagues to acknowledge I'd been pregnant, just as simple as saying, I'm so sorry you lost your baby. I wasn't ready to have a conversation with my team, but I wish someone else could have done so on my behalf so that my team could understand why I was behaving differently. Oops, lost a page. So running the social media accounts for a fertility clinic, I knew that people who were going through fertility treatment and IVF were experiencing the same difficulties in their workplaces. And so Pink Elephants created Fertility in the Workplace, a program which provides companies and their workforces with emotional support literature, video resources, policy change advice, panel discussions where we host conversations just like you've seen before, both with experts in the area and people who have lived experience. These help to raise awareness, and they also offer peer support training for people within these companies. Basically, it's a practical guide for workplaces on how to support women and their partners who are experiencing early pregnancy loss and infertility. And the work they did in this space unearthed another inequality. There was no provision for paid leave for people experiencing miscarriage. You could get sick leave, but if you're having a miscarriage, you're not sick, you're losing your baby. Fair Work Australia did not recognise a loss prior to 20 weeks, and that's despite the fact that 98% of losses occur before 12 weeks. So the Pink Elephants team, led by Samantha Payne, campaigned long and loud on this issue, all the way to Parliament. And finally, on the 2nd of September last year, legislation was passed in federal Parliament to include miscarriage under the Bereavement and Compassionate Leave section of the Fair Work Australia Act. What all of this work means now, 7 years later, is that this wonderful community, women all over Australia and their families, now have a different experience of miscarriage. They have validation, their miscarriage matters, they're entitled to grieve the loss of their babies, and they know they're not alone. Thank you.
Thank you so much for that incredibly emotional and important update on the work that's being done. And I think that that change in Parliament last year was so significant. So congratulations to everyone involved, because that sort of advocacy is hard. It takes a lot of effort, and it's a credit to the organisation. So thank you so much for doing that.